The government is requiring insurance companies to give a base minimum package coverage. Minimum. If you do business in a state and you're an insurer, you're required to put together a minimum package and throw it into an exchange. I call it a pot. Throw a plan in a pot. If you do business in a state selling health insurance, you have to throw a plan for the state into the pot. Now, all those people who don't have insurance are going to go into the pot to get their insurance. A nice, cheap minimum benefits package, and they're in the pot. There's only one problem with that whole thing. The United States government runs the pots, the exchanges. The United States government. So, sounds pretty good probably for you if you have no health insurance right now. You're thinking, I'll go into the pot, I'll get a minimum base coverage for myself, and Dan's got his private insurance and everybody's happy, right? No, that's not it. It's not what's going to happen. The truth is, they're going to raise my premiums so high that I will not be able to afford private health insurance. They're going to force me into the pot. Just like the congressman said, well, you can always go into the exchange. That's right. That is the goal. It's the ultimate goal of government, is to get everyone in their exchanges in their states, all run by the federal government. Now, let me explain how they're going to get me in there. If I decide I can no longer afford private health insurance, they're going to fine the living life out of me. I could be fined as a corporation up to $3 million. And the CBO, their actual budget for paying for all this, actually has billions of dollars for fines. $4 billion listed for fines for individuals, $23 billion collected, estimated collections for corporations like myself that don't pay for it. Now, I said all this stuff to you. Don't take my word for it. I'm actually going to read it to you. So, Mr. Sistak says I should go into the exchange, okay? Here it is. This is on page 22 of 3590. Page 22, you can look it up. $250 million for the state to do the government's dirty work. Now, listen to the quote and listen to the language. And words and contracts and law mean things. Very important to pay attention to the words. Now, the states, according to page 22, and I'm quoting, must monitor premium increases of health insurance coverage offered through an exchange and outside of an exchange. Let me read that again. They must monitor premium increases inside the pot as well as outside the pot. Now, wait a minute. Why are we monitoring rates inside and out? I thought this was going to give patient care, affordable coverage for everyone, right? So why are we monitoring what's going on inside the pot and outside? Well, it says it, and I'm quoting, "The state shall take into account any excess of premium growth outside the exchange as compared to the rate of such growth inside the exchange." Now, listen to the words again. The state shall take into account any excess of premium outside the exchange as compared to the rate of growth inside. There's no excess mentioned for the inside. This is a Freudian slip. This is me thinks thou protest too much. This is an evildoer telling you what they're doing and how they're doing it. Because if this was equal, if this was an equal statement, this is what it would say. It would say the state shall take into account any excess of premium growth outside the exchange as compared to any rate of excess growth inside. That's not what it says. It says there'll be excess only outside the exchanges, the pot. Outside the exchanges is my private health insurance. And they're going to monitor it so they can put me in the pot and fine me to get me in the pot. Now, you don't believe me? That's okay. Let's continue on. Page 73 of 3590. $6 billion for the administration of the exchanges. You think they're not taking this over? Page 200. $60 million for reports from states on how the takeover is going. Page 202. $25 million for each state to develop their exchange. And they can develop multiple exchanges within the state. Page 276. Why would they develop multiple ones? They get $25 million to evaluate each exchange. And then page 297, $500 million for the program management. This is about the takeover of healthcare in the United States by the federal government. This is not about your healthcare. They could care less if you're covered. Just wait and watch part 3 when I get there, and I'll prove it to you. I'll prove it that they don't care about you. But they actually go on in this law to tell you exactly why they're doing it. And this is really amazing. It's on page 125. You can read it yourself. And it's a quote. Health insurance and healthcare services are a significant part of the national economy. National health spending is projected to increase from $2.5 trillion, or 17.6% of the economy in 2009, to $4.7 trillion in 2019. Continuing quote, private health insurance spending is projected to be $854 billion in 2009, and your federal government wants that money. Why would they be mentioning private health insurance money spent? They even go on to say, and it's a quote, on page 125, administrative costs for private health insurance were $90 billion in 2006. They want that money too. If they control this all in the pot in the exchange, all the money spent on healthcare is controlled by the United States. And I'm not making it up. There's no way they're paying for the building of the pots, the design of the pots, the control of the pots, the administration of these exchanges. They're there to take it over, and that's what it is. Now, friends, please watch Section 3. It's about all the rest that's in this. This isn't just about health care. There's a lot more things you need to know. The website is debtorsrebellion.com. I have a People's Bill of Rights I'd love you to take a look at and see if you agree with me so we can take our country back. Please continue on and pass the word of this site, and I thank you very much.